Practice makes perfect, even with sonography. But how do you train if there are no suitable patients available? The Rheumatology Research Group at Bonn University Hospital asked themselves this question and developed their own solution. Joint and artery models from the 3D printer now help them to train sonography in order to detect rheumatological changes at an early stage.
This concept is very special as our working group is the first to enable 3D printing of ultrasound phantoms. And these ultrasound phantoms can be used for early diagnosis of arthritis, for example. We are able to print every joint of the body, which is especially important in arthritic diseases like psoriatic arthritis or rheumatoid arthritis. The second point are vasculitides, and the most common form of vasculitis is giant cell arteritis. And patients with giant cell arteritis often experience sudden blindness. And our working group was able to design vessels and print vessels of the temporal artery and the axillary artery, which are the two most commonly scanned vessels for diagnosis of giant cell arteritis. The third project concerns the interdisciplinary co-work with the team of the gynecology here at the University Hospital of Bonn. We work closely together and we have an interdisciplinary outpatient clinic for patients, for rheumatic women who are pregnant. And due to this cooperation, we were able to design phantoms of fetuses in order to simulate the pathology and normal ultrasound findings in order to train medical students as well as young doctors for early diagnosis of pathology.
For their project, the researchers are using stereolithography 3D printer that uses photopolymerization.
We use a SLA Formlabs 3D printer. The difference between the Formlabs SLA printer, stereolithography printer, and the homemade FDM printer is that we have resins which polymerizates from monomers to polymers with a laser light. The important difference is that the resolution is very high for this printer. Problem is that you have to wash them after the print. You have to wash them with isopropyl ethanol in a tank, and afterwards you need to make them even more durable with UV light and heat. Right now we are using high temp resin. The one important thing about the high temp resin is that it's withstanding 256 degrees Celsius, and we need them for embedding.
The models are placed in gelatin, which transmits sound waves in the same way as human tissue. The cost of a finished model is extremely low, especially when measured against the benefits they bring. The purchase of the printers and the special resin are not quite as low, but here too the benefits clearly outweigh the costs.
Production cost is always not so easy to calculate because what you need is of course a modern 3D printer, and we're not talking about a classical layer printer, and with this modern technology you can print any anatomical structure to its finest detail. Talking about the costs, if you say now we calculated it for example for the temporal artery vessel which we designed for early diagnosis of giant cell arteritis. Here the total cost including the resin, the special gelatine where it is embedded, and the energy cost and also partial cost of the 3D printer, we landed at €5.60. So it is still quite cheap for a medicinal early diagnostic product.
Medical professionals and students can benefit from this cost-effective training method, and so of course can the various patient groups. The ultrasound models are already attracting huge demand, which is why Dr. Schäfer wants to make them available to the masses.
Further plans is we want to get more professional, like every working group. At the moment we have done our project basically for research. But now we want to really professionalize, produce a higher number of models so that doctors all over the world can profit from really inexpensive ultrasound models